Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about the benefits of aquatic therapy as part of your prehab or your recovery after knee replacement surgery. Hey everyone, so today we're talking about the benefits of aquatic therapy. You may hear this referred to as water therapy, pool therapy, all the same things. Basically, doing exercises, doing activities in water, in a pool. Not swimming per se, but doing different exercises, different things such as walking, leg kicks, exercises for the arms in some cases, all sorts of different things, but doing it and performing these things in the water, in the pool. And we're going to talk about some of the benefits of doing that. So the main benefit, and probably the most common benefit and the most important benefit, is the decreased stress and the decreased pressure through the joints of your body. So decreased pressure and stress through your knee, through your hips, through all the weight-bearing joints of your body. And the reason for this is because of the buoyancy of water. So water is buoyant, and this property of water basically decreases how much your body weighs when you're in the water. So for example, if the water is up to your hips, then you're really putting about 50% of your body weight through your knees and through your joints. If the water is up to about chest level, you're putting about 30% of your body weight, and then up to your neck, you have about 10% of your body weight that is going through your joints. And this is again because of the buoyancy of the water. And so along those same lines, in terms of decreased stresses and decreased pressure through those weight-bearing joints, we can also use the buoyancy of water to help with the exercises and the movements that we're doing. So the buoyancy can be used as a resistance to movement, so using it as a way of providing some resistance and making the movement more challenging. It can be used as assistance, so you can use the water and the buoyancy of the water to help with certain movements by going up and down with the water with your leg, for example, doing a leg kick up in front of you or out to the side. Or it can be a supportive type of movement. So that's where you're kind of moving parallel to the surface of the water and using that buoyancy to support your limb or whatever it is you're moving. Another benefit of aquatic therapy or water exercise or pool therapy is the hydrostatic pressure of water. So water exerts this pressure on your body when it's in the water, this pressure. And what that does is has some good benefits for your cardiovascular system. It helps with blood flow. It helps with the efficiency of your cardiovascular system, your blood vessels, your arteries, your veins, and it helps manage and decrease swelling. And this can also help with providing some pain relief because that hydrostatic pressure, that pressure of the water around your joints, acts as another sensation that your body and your different joints feel. And that sensory input can help with your stability, your balance when you're standing and doing activities. It can help you have a better sense and a better feeling of the movement of your knee or other joints of your body. There's also a lot better tolerance for being able to do physical activity and exercises when you're in the pool, when you're in the water. You think about, like we said, that decreased pressure on your joints. You're not afraid of falling or losing your balance. You're stable and comfortable. You have that little bit of hydrostatic pressure that makes you a little more comfortable, helps you deal with pain and decrease your pain a little bit. And all those things put together helps you to better tolerate doing physical activities and exercises in the water. And so really, there's a lot of great benefits for someone who has a lot of knee pain, has a lot of discomfort. We always encourage physical activity, exercise, but when that pain is so intense and so unbearable, it really makes it tough to tolerate and want to be able to do different exercises and activities. So the water is a great option for both people before surgery and after surgery as well as part of your rehab and recovery. Of course, you want to start to move to after the knee replacement surgery, move to doing more land-based activities, weight-bearing exercises, things that are functional and help improve your day-to-day ability to tolerate activities and different things. But definitely a great starting point can be, or addition can be, that aquatic exercise and aquatic therapy. Just another couple brief points to keep in mind with aquatic therapy is, one, you really want to work into it slowly. So that first session, sometimes people will go out there and they feel great and they have way less pain and they're able to move and do so much more, and they just go, they go at it really intense and for a long time. And what happens then is a couple hours when they're out of the pool, they start to feel really, really sore and really, really tired, because you don't realize sometimes how hard you're working when you're in the water, because you don't feel it. It's not as uncomfortable, but you are still really working and physically exerting yourself. So the key is to really start slow and work your way up. Start, the first couple sessions, don't go for as long, maybe don't go as intense or as many exercises, and kind of work it up until your body starts to adapt to that increased activity. And the other thing I would recommend is make sure that you have clearance from your doctor, from your surgeon if it's after knee replacement surgery, just because there are some different things that we want to be aware of, especially if you have any type of cardiac history, cardiovascular personal factors or comorbidities. It's good to get that clearance from your surgeon that you're able to spend that time in the water, doing different exercises and physically exerting yourself in that way. So this has been a discussion of some of the top benefits of aquatic therapy or pool therapy, either before or after knee replacement surgery. Thank you very much for watching, everyone. As always, if you're catching this on YouTube, please subscribe. I post videos almost every day about all sorts of things related to knee replacement surgery, preparation, recovery, frequently asked questions, all sorts of things. Thank you very much for watching, everyone, and have a great day.